Hi everybody, thanks very much for inviting me to the first ever virtual summit of the ERS and ELF Patient Networking Day, and it's very encouraging to see so many people connected. In some ways, probably more people via our social networks as well. And I'd just like to present this project that we've worked on for the last year and a half, MyAVA, an asthma virtual assistant, looking at different ways that we can use digital resources, which now have become so important for us, particularly due to the pandemic COVID-19. So this project was assigned to integrate a new piece of technology, if you like, into the platform that we already had developed, to see if we could begin to use aspects of behavioral science and engagement tools to help people self-care better. It's interesting that we're on this topic today, beginning to take psychosocial support much more as much more an integral part of our care plan, and also how we change or how we adapt to understanding more about behavior so that we can get better results in our healthcare. And it's great to have people like Kilt who are already overcoming those battles, people who are empowered and can be ambassadors and show the way forward. So the first stage of the development was developing content, and the content was developed so that it was adapted to different social profiles of people, and that in itself was quite a lot of work. And we started off with a basic content which could be interesting for people with asthma or useful for them, so they themselves could run through basic topics. It was curated and, let's say, a moderated content so that we're avoiding misinformation as much as possible, which we now know with social media is one of the big challenges that we all have. Additionally, the patients could use our platform, so they could choose a coach and follow a self-care plan as well if they're interested in going one step further and understanding more about managing their disease according to their own particular health issues and lifestyle. So here's a quick clip in English to give a brief overview, and I'll go on to the next slide.
Messages, images, music. Mobile phones offer us so many opportunities these days, and now, if you have asthma, even more. Join the Happy Air community, register and discover MyAVA. MyAVA is your asthma virtual assistant. MyAVA is always at arm's reach to help you improve your quality of life and understand your asthma better. Choose your avatar and start connecting with MyAVA. Respond to MyAVA's questions to get to know you better and learn how to help you out in any situation. MyAVA can share information with you that you find useful. You can even check the air quality in your city, physical activity, how you feel, and even your sleep quality. Sharing these details in your daily life is so important, so MyAVA can help you get on with your life more confidently. MyAVA, your asthma virtual assistant. Find it on www.happyair.org. Messages.
Right, so passing on from the video clip, how do we work with behavioral science? Well, the IT company that clinical expertise in behavioral science called Observia, they're based in Paris, and they had already developed an algorithm to identify a little bit each social profile, if you like, from different aspects, psychological, the kind of use that they may have online, their rationale, etc. And this information helps to, let's say, segment people more specifically about the kind of profile that they have. So one of the profiles we have is free spirits, who I'd liken, say, to a young person who perhaps doesn't go to the doctor regularly, they still smoke, they're not really managing their health issues and trying to avoid them. But what we know is that if we can try and work with people to change a little bit that image of who they are, their perception of themselves, think a little bit more about the kind of information that they need to help them make change. Perhaps we can make a difference there on the way they handle their asthma. So in the MyAVA virtual assistant, they can choose an avatar, and they choose the avatar based a little bit on that social profile. So it's someone that they identify a little bit more. And what we know is the more we learn about you as a person, the better we can help you to adapt to self-care, whoever you are. So MyAVA during the COVID-19 pandemic, of course, nobody expected this to come along, and it became even more obvious that we need new ways to interact with people online to help them manage their health. And these have to be adapted to societal trends. We can't pretend that the world is as it was 10 years ago, and the kind of way people engage, looking for information online and so on, and also the cultural diversity of people and the different age groups. So we need to change the way we provide content for them, the visual style, the language, and make it easy to understand. And also to personalize how each person views themselves and how far their interest lies in managing their own health. From our organizations, we all know we've had huge operational challenges to connect with much greater volumes of people in different ways, people who are confused and looking for support online to manage their own disease and the possible threat or their vulnerability to contagion from COVID. So we're also learning how to engage differently and building on what capabilities we have in organizations to use different channels in different ways of engaging with people and different ways of managing those relationships and helping to support their own self-care models with perhaps new therapies like we're seeing today in mindfulness and so on. How do you get to MyAVA through Happy Air? Well, you can connect through the social media. We have Facebook ads, Google ads, so that if people are looking for help in asthma, maybe they're scared they've got an attack or what the triggers are, they can come to us and register with MyAVA through the website and onto the platform directly in a safe and compliant environment. So what are our 2 to 3 months learning? Well, we had an enormous amount of visibility on asthma management during this period. So from the website and the social media, the interactions just exploded, which means we realize how huge the need for support is when we can identify that level of outreach in the internet environment. We have rapid insights from all users who register. And the good thing is that a lot of people are interested in having coach support. I think it's personally more to have that extra support when needed. They don't necessarily want to have full-time support, but it's good that people are reaching out for additional clinical care support or social care support when they feel that they have situations that are maybe adverse and they can't cope with. We've interviewed 24% of the people, and we have really good positive support from doctors and scientific societies on finding ways of how we can share the information for MyAVA through their networks. And we're looking at how we can achieve that in the autumn. We have a high interest rate from other countries and other languages, even into public healthcare services, of how we could integrate these kind of tools so that people can get the kind of self-care support that they need, especially when they can't connect with their physicians or other clinical staff all the time. And the user feedback has been very positive. What are our challenges? Well, as I said, we all now need to produce very high quality audiovisual content to attract and engage people. As we know, 80% of the online content needs to be audiovisual now. And that's a challenge from an operational point of view because we have to bring in videographer support to work with us on workshops, putting in clips, educational resources that can attract different kinds of users to engage in their own way. Our operational capabilities, as I said, it's a work in progress. We've had to build up a new customer relation environment so we can improve the way we engage with people. And that isn't just emails, it may be SMSs, it may be inviting them to particular events online. And that's segmented a little bit towards the kind of person that is, whether they're a wild spirit or whether they're a patient that is more careful about how they manage their health, but needs some extra support from time to time. So learning about behavior change requires a big shift from Facebook environment, which is not secure. So we really want to make sure that people grasp that managing self-care isn't necessarily achieved in those environments, because it requires a behavior change. And we are seeing that today from the clinical expertise and from KILD of how people need to migrate to a different way of thinking about their health, who they are, and within their own lifestyle. Social media with the misinformation has been huge. I'm sure that all of you feel the same. There's a lot of undoing of confusion. There's a lot of readdressing concepts that people have, myths about management of their disease and so on. And that needs a huge amount of moderation and guidance. COVID-19 has challenged us all internally, our organization. Everybody has been impacted by that personally, as well as professionally. And I think we're still coming to terms with that, and we don't know how the autumn will be. And for us in Spain, there's been a difficulty in connecting with our regular medical advisors to some extent, because they have all been absolutely swamped by the impact of COVID. So what comes next? Well, we now realize, I think more than ever, that digital resources to help people follow self-care plans, tools, training, and connecting are now the safest and the clearest way that we can offer timely support in disease management with treatment issues. And the collaboration is essential across all the stakeholders, whether they be industry partners, whether they be legal compliance partners, doctors, pharmacists, respiratory physiotherapists, and the IT partners who can work with us so that we can design our digital ecosystems to be more successful in helping people to self-care. Patients sharing relevant information in a timely and clear manner with their doctor will be overcome the more that we get to use these and get more familiar with using the resources and overcome that absence. But we do need to build up trust and confidence with people in achieving that goal. And MyAVA as an asthma virtual assistant requires a period of familiarization, a period of learning. So the small changes that we need in adopting self-care need to go step by step for people, so they can grasp that they can see a benefit when they input a certain amount of effort. And that benefit can grow over time until they become much more proficient in self-care. So in the autumn, we're continuing to work to build our internal protocol and capacity in online care management through a network of mobile coach educators who we're working with respiratory physiotherapists so we can support better active living at the same time. And we're continuing to develop our training resources for that network of people so that we can help to build up a network of people who actually understand about online patient care support, which has changed radically from the way we have care delivery in the past. And these people also need to understand how to work online, what kind of tools, but how to keep empathy when they're doing a telehealth exchange with patients, or they need more psychosocial support as part of their care plan, or even the physical activity and the kind of respiratory physiotherapy we can deliver to them. This is all changing in our digital environment, and we have to be able to address that as patient leadership. So my take-home message is really, at the end of this, is we need to empower ourselves and ensure that we gain these operational capabilities as organizational leaders so that we can connect with people in different ways and provide them with different content. We also need to understand that we can't allow people to be sharing their personal healthcare information in any social media, because it really goes against anything to do with current legislation, and our responsibility is to make sure that health data and health information is exchanged in secure environments. And also that we need to gain our own knowledge and capabilities in how we use digital therapeutics from now on, so that people can get better benefits in their clinical care. They can feel happy about doing it. They can report their own outcomes, and we can learn from those procedures much more effectively, and hopefully speed up the kind of care support that people now need in this current era from 2021 onwards. So thank you very much. That's the end of my presentation, and I hope it's been interesting for you.